I'm Tiffany Alexander. We're going to talk about co-occurring disorders, which is a mental health condition paired with substance abuse. Quite often people have substance abuse issues, but substance abuse is not the only issue they have. They're also suffering with anxiety or depression, and often the substance abuse is something that's used to treat the anxiety and depression in the person, where they're really sick of feeling the way they feel, and that's the only thing they found that makes them feel better. Which can be quite an addicting feeling, to have an escape from those anxious feelings or an escape from that depression. If you find a legal or prescription medication that resolves that issue, it's very easy to abuse that. In co-occurring disorders, often you see different medications, legal or illegal, going along with different mental health concerns. So what they found is there's different neurotransmitters that are actually deficit when certain drugs are preferred. So if someone prefers marijuana, if that really does the thing for them, they usually have lower serotonin levels. If they prefer opiates, I think it's dopamine that's usually the lower levels. So there's really some underlying biological concerns, and they also manifest in other ways. People who have depression obviously are going to have some lower serotonin levels. So you're going to see a lot of carryover from a real mental health concern to some substance abuse. It really takes the person having some time that's clean to really diagnose whether they have a true substance abuse problem, or they have a mental health concern that they're self-medicating, or if it's truly a co-occurring situation at that time. We have a couple of different avenues for co-occurring. You have the going to a psychiatrist or your primary care with the assistance of another therapist to get medication for the mental health concern, whether that be an antidepressant, an anti-anxiety, or something like that. So you have the medication on that side. There's AA, there's NA, and there's also programs who are dual recovery basis for people who have mental health concerns as well as substance abuse, so they can address both. And they have a different approach than the traditional AA or NA models.